بسم الله الرحمن الرحيم. المحاضرة بعنوان Diseases of Urinary System Part Number 1. Diseases of Urinary System. Diseases of bladder, including diseases of the bladder, urethra, are common and more important than diseases of the kidneys in farm animals. Before we go to the diseases of the urinary system, we have to know some normal or refreshment about the normal physiology of the urinary system. Urinary system anatomically composed from the kidney. They excrete two kidneys. They excrete the end products of tissue metabolism except carbon dioxide and maintain homeostasis of fluid and electrolytes metabolism, including acid-base balance by selective excretion of these substances. The kidney maintains homeostasis by varying the volume of water and the concentration of solutes in the urine. The kidney composed of many similar nephrons. Each nephron is composed of blood vessels, glomerulus, and a tubular system, which is include proximal tubule, loop of Henle, distal tubule, and collecting duct. In general, the tubules maintain homeostasis while the glomeruli control excretion of metabolic end product. This is the kidney of bovine, which is different from the other kidneys or farm animals. It is lobulated, surface have lobulated and same structure, but the features is lobulated. This is the structure of the kidney. It's composed from the renal vein, renal nerve, renal artery, renal ileum. This is make the renal ileum, and renal medulla, renal cortex. The glomerulus, it is semi-permeable filter that allows easy passage of water and low molecular weight solutes. Glomerular filtrate is divided from plasma by simple passive infiltration. Simple passive infiltration, driven by arterial blood pressure. The volume of filtrate depends on the hydrostatic pressure and the plasma osmotic pressure in the glomerular capillaries and on the proportion of glomeruli which are functional. So this is the simply how the urine made and how is the filtrate occur between the glomeruli and then go to the renal tubules and through the bladder and go outside. Renal tubules, it's resorpable substance, glucose and phosphates as the body need, which secreted from the glomerular filtration, which are needed for utilization and participation in metabolic process, while permitting the excretion of waste products. And organic sulphates and creatinine are not reabsorbed in appreciable amounts. The tubules also actively secrete أيضا تفرز وبصورة فعالة substance, particularly خاصة electrolytes, to regulate acid-base balance and make a balance between absorption and secretion. Number 4, mechanism of water regulation. It depends on antidiuretics hormone. يعتمد على ال ADH hormone. Tissue dehydration and an increase in the osmotic pressure عندما يحدث هنالك جفاف بالأنسجة. وزيادة بالأوزموتيك بريشر. fluid stimulates secretion وبالتالي سوف يحفز إفراز هرمون ال ADH from the posterior pituitary gland. The renal tubules respond to ADH by conserving water and producing concentrating urine وبالتالي سوف تستجيب الكلية أو التيوبيولز renal tubules إلى الإيعاز الذي حصل من قبل ال ADH وبالتالي راح تزيد تركيز اليورين وتسحب السوائل ترجعها إلى داخل الجسم. كيف تحدث renal insufficiency and renal failure? Renal insufficiency means a partial loss of renal function وهو عبارة عن فقدان جزئي لوظائف الكلية. Renal failure أما renal failure فهي means that the kidney can no longer regulate body fluids and solute composition. It is the terminal stage of renal insufficiency. So what is the causes of renal insufficiency and renal failure and that lead to the uremia أو تجمع اليوريا في الدم. بري-رينال أكو مسببات رينال ما قبل الكلية، مسببات من الكلية ومسببات ما بعد الكلية. اللي مسببات البري-رينال including congestive heart failure CHF and acute circulatory failures with acute renal ischemia. Number 2, hemoglobinuric and myoglobinuric nephrosis. And number 3, severe blood النفاخ الحاد أو الشديد can interfere with cardiac output and lead to renal ischemia in ruminants. المسببات الكلوية or renal causes including glomerulonephritis, interstitial nephritis, pyelonephritis, embolic nephritis, and amyloidosis. Number 2, experimental uremia by surgical removal of both kidney ممكن أن تكون واحدة من مسببات renal insufficiency or renal failure. Number 3, post renal مسببات ما بعد الكلية والتي تشمل complete obstruction of urinary tract by vesical or urethral calculus or bilateral urethral obstruction. Number 2, internal rupture التمزق الداخلي لأي جزء من أجزاء القناة البولية urinary tract. ما هي الباثوجينيسيس؟ Its cause, first of all, its cause damage of the glomerular epithelium destroys its selective وبالتالي تأثر لنا على البرميابيليتي أو النفاذية and permits the passage of plasma protein principally البوميز. البروتين المؤثر في عملية البرمابيليتي بين الأنسجة وخاصة في الكدني هو الألبومين. Glomerular filtration may cease تتوقف completely when there is excessive damage to glomeruli. The healthy nephrons compensate to maintain total glomerular filtration by increasing their filtration rates, which may exceed the capacity of tubular epithelium to reabsorb fluid and solutes, causing polyuria and developing renal insufficiency. Number 4, decreased glomerular قلل من نفاذية الجلوميرولاي also results in retention of metabolic waste products such as urea. Also, phosphates and sulphates filtration is reduced, causing renal metabolic acidosis. Phosphate retention increased calcium excretion in the urine, causing secondary hypocalcemia. قلة بكمية الكالسيوم الثانوية. In horses في حالة الكلية حالة الخيول الكلية في الخيول are an important route of excretion of calcium, so the decreased glomerular rate may result in hypercalcemia. الحالة في الخيول تختلف if there is a large dietary intake of calcium. Hyperkalemia زيادة في البوتاسيوم can be a serious complication واحدة من المضاعفات الشديدة أو الخطيرة in renal insufficiency causing myocardial asthma and fatal heart failure which occur in uremia والذي يؤدي إلى حدوث اليوريميا. Loss of tubular resorptive function causes loss of sodium, hyponatremia قلة بالصوديوم دم which occurs in all cases of renal failure resulting in clinical dehydration. The terminal stage المرحلة الأخيرة للrenal insufficiency عدم الكفاية الكلوية هو الrenal failure توقف عمل الكليتين كلياً which is results of cumulative effects of impaired renal excretory and homeostatic function. Continue loss of large volume dilute urine causes dehydration وبالتالي يؤدي إلى حدوث الجفاف. Prolonged hypoproteinemia قلة البروتين لفترة طويلة results in rapid loss of body condition and muscle weakness. Acidosis is also contributing factor to muscle weakness and mental attitude. Hyponatremia and hyperkalemia cause skeletal muscles weakness and myocardial asthma. Renal failure and urinary tract obstruction cause uremia. It is characterized by an increase in blood urea and creatinine isotemia and by retention of other solutes. Clinical finding. This is characterized by number 1 abnormal constitute of the urine مكونات غير طبيعية في البول تغيرات variation بحجم أو كمية اليورين المطروحة بالإضافة إلى هنالك أوجاع في أو آلام في البطن abdominal pain and painful and difficulty in urination والتي تسمى الحالة dysuria and stranguria قلة بالبول مع الحزق عند البول stranguria. Abnormal size of the kidneys, abnormalities of the bladder and urethra, acute and chronic renal failure. أما الآن نتجه على موضوع مهم وهي ما هي the principal manifestation of urinary tract diseases? What are the principal manifestation of urinary tract diseases? It is including the following points. Number 1 abnormal constituent of urine. عندما نريد أن نقول بأنه هنالك أمراض في urinary tract diseases أو urinary tract infection يجب أن تتوفر النقاط التالية. Number 1 هي الاختلاف أو المكونات الغير طبيعية في اليورين والتي تتضمن الآتي. أولاً وجود البروتين في البول. Protein urea causes normal urine contains only small amounts of protein. It is more observed in normal foals, calves, kids, and lambs in the first 40 hours after they receive colostrum. السبب الثاني transitional due to physiological condition, excessive muscular exercise, emotional stress and convulsion, excessive ingestion of protein. فهذه المسببات الطبيعية. أما المسببات المرضية الباثولوجيكال it may be renal والتي مسببها الرئيسي هو congestive heart failure, myoglobinuria, hematuria and hemoglobinuria. Small amounts are associated with fever and toxemia. مسببات الرينال تتضمن glomerular renal infarction, tubular nephrosis, amyloidosis, and urinary tract infection. Post-renal infection or post-renal causes including urinogenital tract infection, cystitis, prostatitis, urethritis, and urethritis. Pathogenesis. Plasma protein enter urine when glomerular permeability is increased, as well as tubular cells degeneration in case of acute tubular nephrosis. Then proteinuria can be quantified by determining amount of protein passed in 24 hours دائما تقاس كمية البروتين خلال 24 ساعة أو خلال كمية البول المطروح خلال 24 ساعة or by urinary creatinine. The highly alkaline urine produced by herbivores can result in false positive reaction for protein. Chronic and acute proteinuria may cause hypoproteinemia as occurs in chronic glomerulonephritis and acute tubular nephrosis in horses and in amyloidosis or cattle. المكونات الغير طبيعية الأخرى باليورين بالإضافة إلى البروتينيوريا هي نمبر 2 cast and cells الترسبات والخلايا. cast are organized منظمة الكاست الترسبات tubular structure دائما تأخذ شكل التيوب الرينال tubules اللي تتكون بداخله which vary in appearance depending on their composition وأيضا تختلف شكلها حسب المادة التي كونتها. مثلا الكاست أوف كالسيوم تختلف عن البوتاسيوم، تختلف عن الصوديوم، وبالتالي من خلال الأشكال المحددة وخلال فحص البول يجب أن نتعرف على أي نوع كاست موجودة في اليورين. It is indication of inflammatory or degenerative changes in the kidney where they form by agglomeration or desquamated cells and Tamm Horsfall protein. Casts may not form in all cases of renal diseases. Casts rapidly dissolve in alkaline urine and are best detected in fresh urine samples, erythrocytes, leukocytes, and epithelial cells. And urine may originate in any part of the urinary tract. التغيرات الثالثة في أو principal manifestation of urinary disease is hematuria. Hematuria is the presence of red blood cells or clots in the urine. أما مسبباتها دائما في حالات الأمراض urinary system لازم نعرف مسبباتها اللي هي pre-renal causes, renal causes or post-renal causes. فبحالة الهيماتوريا المسببات البري-renal فهي trauma to the kidney, septicemia, anthrax, leptospirosis, hemorrhagic septicemia, and purpura hemorrhagica. Renal causes include acute glomerulonephritis, renal infarction, embolism or renal artery, pyelonephritis, tubular damage by sulfonamides, arsenic, phosphorus, and lead toxicity. Post-renal causes include urolithiasis, cystitis, faulty catheterization عندما نعمل طريقة غير صحيحة عملية القسطرة, blood from the reproductive tract, exotic hematuria of cattle when hemorrhage originates from the tumors of the urinary bladders. In severe cases of hematuria, blood may be avoided as grossly visible clots or deep red to brown colored urine. Less severe cases may show only cloudiness which settles to form red deposits on standing. In slight condition, detect only on microscopic examination of centrifuge sediments. Hematuria for long period results in blood loss and anemia. Number 4 تغيرات وهي الهيموغلوبينوريا. هيموغلوبينوريا يعني وجود الهيموغلوبين بداخل اليورين. التغيرات الموجودة في اليورين. It is the presence of hemoglobin in urine causes see also post-parturient hemoglobinuria. false أما تكون أحيانا مسببة أما تكون المسبب حقيقي أو كاذب. إذا كانت المسببات كاذبة false causes it occurs in hematuria when erythrocytes are lysis and release their hemoglobin. In this case, erythrocytes can be detected only by microscopic examination of urine sediments for cellular debris, while the true causes causes a deep red to brown coloration of urine. It gives positive reaction to biochemical taste of hemoglobin. There is no erythrocyte debris in the sediments. Hemoglobin liberated from circulating erythrocytes is converted to bile pigments in the cells of the reticuloendothelial system If hemolysis exceeds the capacity of this system to remove the hemoglobin, it accumulates in the blood until it exceeds a certain renal thresholds and then passes into the urine. And finally, some hemoglobin is reabsorbed from the glomerular filtrates by tubular epithelium. Hemoglobin precipitates to form cast in the tubules, especially in the urine, is acidic as results. Some pluging of tubules occurs, but the chief cause of uremia and the hemolytic anemia is ischemic tubular nephrosis. Ischemic tubular nephrosis. في المحاضرة القادمة أو الجزء الثاني نكمل المسببات أو ال principal manifestation of urinary system diseases. Thank you.